Hi, thank you for joining us today. We'll be discussing EHR non-interoperability. Next slide, please. While EHR technology has been around for decades, the integration of technology in healthcare is slow. In fact, as of 2012, 63% of physicians use the fax machine as the primary means of communication. Next slide, please. Electronic health records, or EHRs, exist to improve quality, safety, and efficiency of care provided. The data collected can be used for education and research. EHRs can provide a system of checks and balances for care decisions and link healthcare providers to institutional protocols. The impact of EHRs is complicated. Implementation is expensive, resulting in a gradual and inconsistent adoption of a large variety of EHRs. EHRs increase the time healthcare providers spend on administrative tasks and decrease the time spent on direct patient care. Patient harm issues, provider burnout, and patient dissatisfaction are correlated to a lack of EHR interoperability. Patients, caregivers, providers, administrators, and lawmakers must be able to communicate in order to provide medical care. EHR interoperability must be addressed to connect a siloed healthcare system. Next slide, please.
So what is interoperability? Interoperability in theory would allow for access to and exchange of data with the goal of optimizing the health of individuals and populations. However, being that there are hundreds of different types of EHR tools used in health systems across the United States, it is difficult to create one standard interoperability format for sharing data. Next slide, please. In a Business Insider Intelligence report from 2020, only 28% of US hospitals reported utilizing Epic, 26% Cerner, 16% Meditech, and so on, with astonishingly almost 10% actually reporting having none or other. Next slide, please. With such a diverse EHR platform usage, it is undeniable that there will be communication barriers that can cause errors, backlog, and misinformation in patient information, data collection, cost control, quality and patient safety, and privacy and security. Next slide, please.
With regard to our analysis, our first recommended solution is to conduct an organizational review to evaluate the effectiveness of hierarchies and processes facilitating inter-unit collaboration. The second is administrative support, which involves establishing a robust scribe system to aid in administrative workload. The third recommendation is establishing a committee to track use of existing government programs and to work with other like organizations and/or agencies to collaborate with government representatives in advocating for the development and implementation of other government programs to assist in paying for EHR interoperability associated costs. To evaluate the implemented recommended solutions, we advise in the track and trending of patient and staff satisfaction, patient safety events, HEDIS metrics, organizational costs, and overall productivity. These tracked and trended metrics will reflect the impact of the solutions with regard to organizational culture transformation, quality of patient care delivered, patient outcomes, fiscal viability, and operational effectiveness. Regarding future steps, and in summary, want to maximize current technology and resources and implement proactive planning for future initiatives. This concludes our presentation. If you have any questions, please let us know. These are some of our references and resources. Thank you.